My name is Aislinn Vaughan, and I practice out in St. Charles, and I'm a general surgeon who specializes in breast surgery. I did a medical school in Indiana at Indiana University, and then I did a surgical residency at Good Samaritan Hospital in Cincinnati, Ohio, and then I did a fellowship in breast surgery at Washington University here in St. Louis. I decided to do an extra year of training to be an expert in that area so that I could really provide expert care for my patients. At the time thinking I might do general surgery, but during that year I realized that I just very much enjoyed taking care of breast cancer patients and women with breast problems and decided to focus all of my attention on that. I think the biggest thing is our sort of close attention to detail and our compassionate attitude in trying to make sure no one falls through the cracks, that they're kept up to date on their care. I'm a very upfront, frank person, so I tell people exactly what's going on. I don't like them to have to guess. I don't make them wait to come back to the office for results. I think it's their disease, it's their body. If I know what's going on, they should know what's going on. I think any truly good breast cancer program is going to be multidisciplinary because there's so much that goes into the care of a breast cancer patient. So most really excellent facilities, when you're there as a breast cancer patient, your surgeon meets with medical oncologists, radiation oncologists, pathologists, plastic surgeons, radiologists, and we talk about a particular patient and make sure there's not something we're missing, making sure that we're all on the same page and there's not another option that we need to consider, so that you're really getting way more than one opinion with your one visit. I do specialized techniques, particularly with mastectomies. Skin-sparing mastectomies are very much becoming standard of care when women choose to have reconstruction of their breasts, which means that we spare as much of their skin as we can to provide a good cosmetic outcome but still adequately treating their cancer. So I always encourage meeting with a plastic surgeon who works closely with us, and we will typically do their breast reconstruction at the same time as their mastectomy, which certainly helps from an emotional standpoint that they still have a breast mound, so to speak, when they wake up from surgery, but it also helps with their long-term cosmesis, and so I think that's something that we can offer, which is a great thing for patients. It sounds kind of bad, but a woman who has a challenging case that is a breast cancer, I actually feel good when we can find it at an early stage where we can treat it rather than have the patient present down the road when maybe it's not quite as treatable. So even though it's never an enjoyable experience to tell a woman she has a breast cancer, it's certainly nice to know that you found it at a time when you can help them and take care of them and hopefully save years of their life. I think that any organization that's trying to provide best care, you're going to have groups of people getting together, really analyzing what services you offer, what can we do to make things better, and so I think we're all working to make things perfect for patients as we can. Obviously nothing is perfect, but everything we can do to improve things is great.